Do you snore? Is that a problem for your mate? Do you get the elbow from your wife or your husband when you sleep at night because you snore too much? Or perhaps your mate sleeps in another bedroom because you're snoring too loud. Well, if that's the case, you're in the right place. I'm Dr. Albert Benheim. I am the medical director of Physimed MediSpa. Welcome. So, nowadays, we have new technologies that help us treat patients that suffer from snoring. There are many technologies and many tools out there to help you with snoring. But there is one in particular that we use at MediSpa Physimed, which is a laser that really helps patients in a very effective way to reduce snoring substantially. So what does the laser do? A lot of patients ask this question. And first of all, we need to understand why we snore. The reason why we snore is because when you breathe at night, the air that goes through your airways encounter an area of turbulence. If there is an area of turbulence in the passage of the air, there is a sound that comes out, which makes you snore at night. As an example, if I take a hose and I hook it up to a water tap, and I want to water my lawn, for example, I can open the water tap and the water flows through the tube, through the hose, and there is no noise at the end. However, if I squeeze the tube, creating an area of turbulence at the passage of water through the hose, then I hear a sound, which is a kss, like this, because of the turbulence that comes from me squeezing the tube. So turbulence in the passage of the air through our airways creates a sound where you snore, just like turbulence in the passage of water through the hose creates a sound when you water the lawn. So the reason why we have a turbulence when we sleep at night, this turbulence comes from the vibration of something called the soft palate that is in our mouth. So the roof of the mouth is called the palate. In the front, you have the hard palate, which has bone. That's what we call it, hard palate. And the extension of the hard palate is the soft palate. This is where we see the uvula. And the problem with the soft palate is that when you lie down, the soft palate collapses against the back of your throat. And then when you breathe, it starts to vibrate, creating a turbulence which leads to you snoring. So the whole objective, the whole principle behind the treatment with laser is to create a tightening of the soft palate so that instead of vibrating a lot, now the soft palate is tighter and vibrates less. How does the laser works? So essentially, we pass the laser all over the soft palate, following a certain protocol, and the laser stimulates your fibroblasts to secrete more collagen and elastin. So in our skin or our tissues of our body, what gives us firmness or laxity, meaning how loose our skin is, has to do with the density of molecules of collagen and elastin that are made by certain cells called fibroblasts. By using a certain type of laser over the soft palate, we're able to stimulate those fibroblasts to secrete more collagen and elastin. Therefore, the tissue where there's more collagen and elastin becomes firmer, and the soft palate, once it's firmer, vibrates less, creating less of a turbulence, and therefore reducing significantly your snoring. So when we treat patients with laser, the treatment is usually lasts about half an hour. The treatment is really painless. You feel a bit of heat behind it. This is a non-ablative laser, so it doesn't cut anything. You're not bleeding or anything like that. Plus, after you're done with the treatment, you can go and eat, drink, sing, whatever you want, in the sense that there is no downtime after treatment. So typically speaking, we can, usually we need about 3 treatments to treat patients, but depending on the level of snoring that you have, if you're a severe snorer, you may need 4 or 5 treatments. We are able today to use technologies to quantify how much you snore, and we're able to attribute a score to a patient so that we know how much this patient snores and how much we can reduce the score, the snoring score, over time with treatment. So we're able to objectively demonstrate to patients how much we help them with their snoring problem. And furthermore, what's interesting is that this treatment also helps patients that suffer from sleep apnea. So as you may know, the gold standard for sleep apnea is a CPAP machine, but a lot of patients cannot get used to the masks or having to sleep hooked up to a machine. And a lot of patients stop using it or don't even purchase it to start with. So this treatment, the good news is that the laser treatment for snoring also helps sleep apnea. And you may be able to do without a CPAP machine. So if snoring is a problem for you, or I should say for your mate, I invite you to come and see us. Your first consult or the initial consultation for evaluation is free. We don't charge patients for this. And I think you'll be very satisfied with this type of treatment. So looking forward to seeing you soon.